Hey, so we're just getting started with the Decibel, and we want to get your opinion. We've set up a brief survey, and if you fill it out, we'll give you the chance to win some prizes. Listen to the end of the show for details. I'm Tamara Kandaker, and you're listening to the Decibel. You might remember at the start of the pandemic, many people predicted that it would be the great equalizer, that anyone, regardless of race or socioeconomic status, could fall victim to the coronavirus. We learned pretty quickly, though, that this was never going to be the case. Lower income communities where there was a concentration of racialized people and essential workers were hit way harder by COVID-19. And one of the places that's been in the headlines consistently throughout the last 15 months is Brampton. Brampton is a city about an hour outside of Toronto with a predominantly South Asian population. And it's home to thousands of people who work in factories and warehouses helping distribute goods across the country. As of Friday, 14.5% of COVID tests in Brampton were coming back positive, compared to 5.4% in Ontario overall. For the last few months, the Globe and Mail's been looking specifically into one Brampton neighbourhood that's seen some of the worst impacts of COVID-19 for a project called L6P. L6P is the postal code for the northeast corner of the city. It's consistently seen some of the worst positivity rates in Canada. Its hospital has been overwhelmed with emergency admissions, and the pandemic's economic impact on the area has been devastating. L6P residents also rank among the top recipients of the Canada Emergency Response Benefit. The L6P project looks at the many reasons why the pandemic hit this community so hard. But today, I want to focus on one part of the story: how people in Brampton have been getting their information about COVID-19.
And so essentially, a lot of people were in the dark because we didn't make those efforts early on to have government ads, to have public health officials, or to have translators to go provide this information to public in a linguistically diverse manner.
Amanpreet Brar is a doctor who lives in Brampton, and she's been working to fill what she sees as a void. She's been going on Punjabi radio and TV stations and talking to people about the pandemic, and she says the lack of information's been helping to drive community spread. We asked the Ontario government to tell us about the public health ads they've been making about COVID-19 and Punjabi. When they started, could we listen to a radio ad? They didn't answer those specific questions, but they did attach an example of a print ad and said they'd been pushing out health-related messages in many languages, including Punjabi, since March 2020. But Amanpreet says the province's messages haven't been reaching the people she's been talking to. We also talked about her experience working in factories in Brampton and what made the city uniquely vulnerable to COVID-19. That's today on the Decibel from the Globe and Mail. Let's get into it. Hi, Preet. Thank you so much for coming on the show.
Hi, thank you so much, Tamara, for having me today.
So, Preet, you moved to Canada and you've been living in Brampton since 2005. So, for people who haven't been to Brampton, can you just describe it to us? What is it like?
So I see Brampton as a city of, hardworking, essential workforce that runs the economy of our province and our nation, as well as a city that is very welcoming and very multicultural and diverse.
And I know before you got into medicine, you did temp work in some factories in Brampton. And I wonder if you can tell me a bit about that experience and what did you see in your time working in factories that kind of influences your work now?
Yeah, so when I immigrated to Canada, I worked as a temporary employment agency worker, and I would be, at the mercy of agencies to call me to work. So if they don't call me for work, that means no payment until they call me, essentially. And you're sent to different workplaces. I worked from floral nurseries to Zellers, warehouses where I was putting boxes on the conveyor belts, to shampooing, manufacturing. You sort of go across different factories through the agencies and you rely on the agency to send you wherever they can. And so you're paid less than your permanent counterparts. And the agency obviously takes some amount of the money that should have obviously been given to the worker. And on top of that, you don't have paid sick leave. And you also don't have any benefits, like any vacation benefit or benefit for any prescription medicine. And during the pandemic, when I heard of workplace outbreaks, really my mind jumped right away to the manufacturing area, because I couldn't imagine the vulnerabilities of workers, during this pandemic, working through those conditions. And right away, I sort of stipulated that without a paid sick leave and without job security, these workers would be in a very vulnerable position. And, I thought myself to be in a well position to understand some of those factors that might have been driving the workplace outbreaks. And then we saw that play out in the data. We saw that workers were going to work with symptoms in places like Brampton.
Why was Brampton hit so hard by this pandemic? And why has it become such a relentless hotspot?
Brampton receives approximately nearly $1,000 less in healthcare funding per capita than elsewhere in Ontario. And then the provincial average for hospital beds is 2.19 beds per 1,000 residents. However, Brampton only clocks in at 0.96 per 1,000 residents. So that to me is systemic discrimination and inequitable healthcare system. And, to me then, I'm not surprised seeing those numbers, why communities like Brampton's have inequitable outcomes, whether that's during pandemic or beyond pandemic.
I've also heard there are a lot of multi-generational homes in Brampton. How much of a factor do you think that's been in community spread?
One of my pet peeves is when people talk about multi-generational housing. It makes it sound like it's a cultural phenomenon, that a multi-generational housing is purely a cultural choice, whereas multi-generational housing is often a socioeconomic model as well. And we really mask the crowded basements under the label of multi-generational housing. When we know that a lot of new immigrants in places like Brampton are living in crowded basements, are not actually in fact related to each other. It's crowded housing because of lack of affordable housing. And then the other aspect that I think it misses to also encompass is that childcare has also been really hard to afford, especially for low-income workers. It does really play into the multi-generational housing as well.
Now you do these appearances on Punjabi radio and TV stations, and you take questions from people about COVID.
ਇੱਥੇ ਮੈਂ ਇਹ ਕਹੂੰਗੀ ਕਿ ਆਪਾਂ ਨੂੰ ਜਿਹੜੇ medical health officer ਆ ਜਿਹੜੇ PH Dr. Lawrence Lowe ਹੈਗੇ ਆ.
What made you want to start doing that?
Yeah, so primarily my advocacy during this pandemic was regarding essential workers. So I started this social media campaign called Humans in Brampton, where we were interviewing essential workers, traditionally workers from precarious sectors who were often not highlighted in the mainstream media at that time, because we heard a lot about healthcare workers being celebrated, but I wanted to shine light on the working conditions of the precarious workers and low-income workers. What was interesting, what came up during those discussions to me was when I spoke to some of especially the truck drivers who did long trips to US, they told me that, they listen to mostly Punjabi radio, Hindi radio, Urdu radio, and that's their only source of information. And they told me that they've never heard anything about COVID on these radio shows. And there was no public health officials, no government ads. There was really nothing on these channels. And so that's what motivated me to, reach out to these ethnic channels to spread messaging about COVID-19.
So it sounds like people in Brampton really rely on ethnic media to get any information about the pandemic. I wonder, what do you think were the consequences of the government not communicating to people in their own language?
So these are really important information dissemination tools that are used across our continent, essentially. It was really shocking to me because when it comes times for elections, our politicians are heavily rely on this ethnic media to run their campaigns. And they're very well versed in leveraging these ethnic media relationships because they know how important they are. So to me, it was very surprising that the same efforts were not made during the pandemic to save lives.
What were some of the information gaps that you noticed?
I was just surprised that there were such gaps in knowledge about COVID, from precautions, from basic public health guidelines. This was early on in the wave 2 of the pandemic. I got questions where you would think, if I watched mainstream media, there was this information was all over on social media and on all mainstream channels. But on a lot of these ethnic media channels, there was not the same urgency about pandemic, and there was no same messaging about pandemic.
Right.
And so essentially, like, a lot of people were in the dark because we didn't make those efforts early on to have government ads, to have public health officials, or to have translators to go provide this information to public in a linguistically diverse manner. I mean, it's been better. It's definitely become better over the pandemic. I certainly have now, over the last 2-3 months, seen some advertisements on some Punjabi radios. We definitely still could do a much better job in using these platforms.
So you've been doing this now for around 6 months. What kinds of questions have you been getting from people?
Yeah, I mean, people have called in about, how serious is the situation. People ask me that a lot because it's hard for them to sort of understand the numbers sometimes, right? Because sometimes we say the cases are going down or the ICU admissions are high. Like, it's really hard for people to understand, sort of assess, like, where are we in the situation? And now when it comes to vaccination, people have certainly asked me a lot of questions about side effects, about sort of messaging regarding AstraZeneca, which was confusing enough for someone who speaks English and consumes mainstream media. You can imagine that if they're not getting that same information, how difficult it would be to process that information.
There's been a lot of misinformation and conspiracy theories about COVID-19, and I'm wondering if you've been getting questions about those on the shows that you've been on and what kind of advice you've been giving people.
While I was awaiting my turn once, I heard an alternative care provider come on the show and talk about side effects of medicine and how we should stay away from medicine. A lot of the times I heard alternative care providers come on these ethnic shows, and this has been happening for years and years, where, there is alternative information on these channels, but there's no information from healthcare providers. And now we have pandemic and we're trying to promote vaccination, but we're fighting against years of misinformation and years of lack of information. But I think overall in Canada and, even globally, often misinformation happens because of lack of information and from our failure to meet communities where they are and to provide information in the way they consume information.
How do you think the government could have better communicated with the Punjabi-speaking community in Brampton?
We know Canada is very multicultural and we're very linguistically diverse. And I think even beyond Punjabi-speaking community, we have Tamil-speaking communities, in Scarborough, we have, Urdu and a lot of other languages in Canada. And I think overall, our government should have used these ethnic and multicultural media platforms to communicate with the public. But I think what we have to understand is that people who do speak English don't always necessarily watch mainstream media at home.
Yep.
They often watch ethnic media because they want to, watch a Bollywood movie, or they want to watch, something in their own language just to stay connected to their culture, their heritage. And that's important, for all communities. And Canada is so multicultural. And I think we're always really proud of that. But we also must remember how multicultural we are and how linguistically and culturally diverse we are in our responses, especially during the pandemic.
So as more and more people are getting vaccinated, are people in Brampton starting to feel a little bit more hopeful that we're past the worst of the pandemic? And I guess I would ask you the same question, like, are you optimistic about where things are going in Brampton?
Yeah, certainly. I mean, we saw, the doses after the dark campaign, like we saw,
Tell me about that before you move on. What's the doses after dark campaign?
Oh, so the Doses After Dark was like a 32-hour vaccination, like a marathon that happened in Peel region, including Brampton. And that was very successful, where, a lot of essential workers got vaccinated overnight. Like, there was huge long lineups till like 2 a.m. to get vaccinated. And so, we see more and more vaccination of communities like Brampton, and that's certainly very hopeful.
Preet, thank you so much for doing this, and thank you for all your work on this.
Thank you for the opportunity to come to your show today and shed more light on this issue. So thank you very much for amplifying the voice.
All right, that's it for today. I'm Tamara Kandakar. Our producers are Madeline White and Kasia Mihailovich. David Crosby edits the show. Angela Pacenza is our executive editor. Thanks so much to Dr. Amanpreet Brar. You can read the L6P project on theglobeandmail.com. If you like this episode, please leave us a review on Apple Podcasts. Also, if you want to say hello, you can email us at thedecibel@globeandmail.com or tweet me at anima_TK. If you haven't already done it, follow The Decibel wherever you listen to podcasts. Thanks so much for listening, and I'll talk to you tomorrow. And here are the details on that survey. We want to know about you and what you'd like to hear on The Decibel. Just go to thedecibelsurvey.ca, fill it out, and as a token of our appreciation, we'll enter your name to win one of 3 $50 grocery gift cards. Once again, that's thedecibelsurvey.ca. Please do it. It'll really help us make this show better. Thank you so much.